Bring the Governor Lou Leon Guerrero, up onto the show. Morning, Gov.
Good morning, Chris.
Half a day, Governor.
First of all, we were just talking about these messages of support that you're starting to see on social media everywhere. People making signs, just trying to show that they're standing behind our frontline healthcare workers. What do you make of those messages, Gov?
I think that is so powerful. As you know, social media is a medium that people use very frequently. And I think whatever positive information, official information that we can push out through social media. I've been watching those videos, and there's a lot of creative ones. And I think as much as we can circulate it and distribute it out, that is great because, like I've always said, we need the whole support of the community to fight this battle we are with this god-awful virus. And I'm just also saying, Chris, that, we cannot let our guards down. We cannot be complacent. We have to be really, really insistent and persistent in staying the course. The actions that we have taken and the mandates that I have made is right on with in comparison to also all the other international countries and also the states in the United States. What we have going is that we have done these actions early on before we even seen more of the COVID positive. I don't think we're out of the woods yet. I think we'll still see some more. We are still getting, responders, first-line responders, transporting patients to either GRMC or GMH. We're still testing them. We're still monitoring them. We're still doing home isolations, and we're doing facilities, isolations, quarantines. We're doing everything that we know works. And again, it won't be successful without the support of our community and our people. So let's all work together. I know there's a lot of criticisms out there, but can we just use our energy towards working together to fight this, like I said, god-awful virus?
Governor, we just heard the president, he just announced that he would be extending the social distancing policy, I believe, by another till April 30th. Are you planning to follow suit, or are we going to stick with the 13th?
I'm still sticking to the April 13th, but I'm looking at what is evolving in the next week, and there's certainly a possibility to extend that some more. Like I have always said, it would be much more tragic if we prematurely lifted anything and then we start off again with contamination. And I don't know if I'm pretty sure you've seen this. There's graphics out there that shows why we need to really be serious about this, and it shows about how one person can infect 2.6 people. That 2.6 people infects, it's an exponential increases, and that's why this is very concerning. But it also shows that if you work at home or if you stay home, it shows the decrease in those contacts, which then decreases contamination throughout the community. I'm sure you've seen those.
Right, yeah. And I was just watching something over the weekend, Gov, where they talk about how contagious COVID-19 is, and that's why these social distancing measures, which we've never really, in my lifetime, I've never even heard the term social distancing. So we're all...
Or social isolation.
I mean, we're all dealing with this unprecedented wave.
And that's even... all over the world, Chris. It's not just us. You heard statements from leaders and experts in CDC, experts in healthcare saying this is an unprecedented event. There's really no template to use to guide us along. And as things move on, they research and then they, create guidelines. Sometimes those guidelines change even as we speak. And that's why sometimes, our processes change and our decisions change. And so we're moving along, and believe me, we are in constant contact with federal experts. We're in constant contact with the White House, and so forth. And I just have to say, we've been getting good responses and good assistance. I would like to get more test kits here, and I'm also working with the military. Admiral Davidson from Indo-PACOM is aware, and so is Admiral Manoni. So they're working also their military lines to get those test kits here for us. And, they're offering also help and assistance in helping out with our testing of our specimens. So we've got assistance from federal, military, our community, so we just have to stay the course. And I am confident we'll get over this. China is starting to rebound. Their recoveries in China is 72,000, and their cases is 81,000. And South Korea is recovering. Japan's showing a little bit increase, and I didn't check the Philippines today, but the U.S. is the greatest hot spot now. They're up to like 131,000.
Crazy.
There was
and it's just the beginning. Some states don't even have it yet. Like Miami, oh my gosh, all those spring semester students that were down there, and then they went.
Yeah, Z9, party night.
I wanted to ask you about a follow up on something that you briefly mentioned during a briefing last week with the media, and it's actually an issue that we've been discussing on our radio show with respect to the homeless population. And what are the plans to address?
Okay, so we're looking for the homeless. This is Sabrina, right?
Yes.
Okay. So, Sabrina, with the homeless, the lieutenant governor is working very closely with the coalition. We're trying to either get tents or some kind of temporary structures to house them in. And we are very concerned about the homeless too. I think there's like about 100 in Hagåtña. So we're looking at places that we might use to house them close by to a facility that has, bathroom and showers and so forth. So our response team is focused on that priority.
Gov, I talked to Linda DeNorsi this morning, and we had asked her Saturday, Sunday, those 2 days combined, the number of tests run would have equaled what we were normally running on a weekday. So I said, hey, what was up with the number of tests we ran over the weekend? And she said, we're all caught up, Chris. I know that there was a queue combination of maybe some of the clinic tests, and I don't know, maybe some of the stuff from NMI. So can you confirm that? Are we hitting the ground, kind of starting from zero this morning as far as the
Actually,
tests?
I think yesterday is what I heard. But, as you know, there's a group of doctors that look at these, that go over these specimens and priority rate. And so that's where this group of doctors created this priority of testing. And everyone that comes to the hospital with symptoms and so forth are a priority. People with comorbidities are a priority. Healthcare workers are a priority. And of course, Arman Umko is on that list also of priority. And so Linda's right. As they have to, because she can only test 40 a day.
Right.
And so she was making sure that those priorities are tested. And then so you may be one that goes to the back of the line, and then now she's caught up with all of that.
Right.
Mm-hmm. Yeah, Governor, we had a Geron Gondole on the radio show earlier today, and she actually wrote a letter. She sent a petition over to Crystal Pacos and Augustine. It's Concerned Mothers of Guam. And I know it's been brought up during the press briefings about the movement of the child maternal ward?
Maternal child health.
Right. And she just had her baby on Saturday, and she's still concerned about the condition of GMH and why they
Oh,
haven't
yeah.
been moved?
So, really, I'm impressed with the way GMH is controlling these COVID cases. They are not anywhere near the maternal child health. The staff that that uh, that take care of the mothers and the babies are not at all mingled with the other staff on the other floors that do the COVID cases. So they're strictly following their infection control, and so that's a good thing because the controls are in there. Now, what we are doing, I don't know if you're aware that we created this public health system where now we are combining GRMC and GMH as one hospital. And so staffing and all that is going to be interrelated. And so the doctors are looking at ways to decompress GMH so that they have capacity for incoming cases. So they're working now at ICU, so they're moving non-COVID patients over to GRMC. And the issue with with the maternal child health, it's a discussion. And Dr. Mike Cruz, who's my medical advisor, has told me that they're going to be working with the decision of the medical advisory group. So I think that's on the list for decompression.
Okay, and this is part of
And
the unified.
What that means is we're trying to, when I say decompression, we're trying to move most of non-COVID cases over to GRMC, and GMH would be considered the COVID case hospital. And
Right.
so we're trying to beef up our capacity because we want to be prepared once we start seeing a surge in patients with COVID.
Okay. In anticipation of that, you did mention it about the Army Corps of Engineers and the discussions that you've been having and how you've assigned the tag, Esther Agagi, to be in charge of that effort. Where are we on that? And is that something that we will definitely see, or it's just in talks right now?
Yeah. We are looking at all options, okay, to increase our capacity to 2,000 beds. And that's just what we want to do to feel, that there's that cushion, right?
Mm-hmm.
So we're looking at even bringing in Blue Med plants. We're looking at Army Corps of Engineers offering this conversion from a facility to a hospital facility. We're also looking at bringing in a barge. There's been an offer to bring in a barge that can be hospital retrofitted. Yeah.
Wow.
So what we're doing is we are preparing. Like I have said, we're not out of the woods here, and my win would be if we can minimize the cases of positive. And if we're seeing 3 to 4 cases a day, that's inspiring for me. And also, I just want to be prepared should we have a big surge of people that come in with positive cases. Yeah.
And Gov, are we really anticipating that surge? Because, like you said, limited priority testing for COVID-19. And talking to Dr. Cabrera, it kind of seems like they really got a handle on that. And so now I'm assuming the testing is going to go. It's going to be more widespread. So are you anticipating that we're going to get more positive results, given that we're now testing a wider group of people?
Yes, that's what we're seeing in other places. The more you test, the more you find the positives. And that's why, Chris, I say to everybody, assume that you're all positive. So regardless whether you're tested or not, the action and treatment is the same. And it is stay home, wash your hands, cover your cough. minimize your contact with people, protect our uncle. As I would say, 45% of our positive cases are people 60 years and above.
Right.
So we need to really protect that group of people, and the fatalities are higher in that age range also.
Gov, I know that you are extremely busy, and you were talking about how you've been criticized, or your administration has been criticized. But there's a lot of work that actually you guys are doing. And just over the weekend, I want to talk about how the president, he declared the major disaster declaration for Guam, and what that means for the territory. You also signed the agreement with the U.S. Department of Labor. If you could just assure the community that help is on the way.
Help is on the way, absolutely. This is, I do a weekly conference call with the president, the vice president, and all the governors of the states. And President Trump has been pushing these help. It's like a $2 trillion assistance. Also, the last two, I think, or the first two, I think, comes up to about $58 billion. So they are working also very hard with the Congress to get these assistance. So absolutely, we are looking. We have created, Sabrina, a new program, and Department of Labor in the U.S. The U.S. Department has been so cooperative in this and so supportive, because they know that we do not have unemployment insurance. So they created the pandemic unemployment benefit, right? And that's the one that they're talking about, where if you have been unemployed because of the coronavirus situation, that you will be getting a weekly sum of money for 9 months. They're saying it's 9 months. And so we're just ironing out the weekly amount now. And so we are working to we've already signed the agreement, and we're working the process now on how to effectuate that agreement. But it was like signed right away.
Right.
And also we're looking. There's a lot of benefits too with the loans. I was just talking to Ricky, and because Ricky's the guy I tasked to go through this law, and he has been actually going through it since 2 weeks ago when we first started hearing about it. And there's a lot of federal programs for loans. Companies can borrow guaranteed loans from the federal from banks, and they can also forgive those loans and work as if it was a grant. So there's Small Business Administration has loans, so that I'm just saying, with the business community, of course, cash is what they need. And so if they go to borrow these, they get the cash up front, but also they can be forgiven, and or also get a small business loan for up to $2 million at a really low interest rate for 30 years. So there's a lot of economic opportunities there to start up again our engine. Every state economy is, I would say, dead, like ours.
Well, yeah, I don't think anyone's disagreeing with that assessment.
Yeah.
Right. Yeah.
Yeah.
Not really anything
Although
to
we
laugh
still
about.
have some, activities here, because grocery stores are open.
Right.
Pharmacies are open, medical clinics are open, gas stations are open. And I just want to emphasize again, please limit your activity out there. Limit your contact. You are the ones that are going to help us win this war.
All right.
Well, thank you, Gov.
Thank you, Chris and Sabina, and thank you. I love your media stuff too. It's very professionally done, and I think because you guys are in the media, people also see you as good messengers So thank you, and keep it up.
Well, thank you, Gov.
Thanks, Gov.
All right.
Okay,
All right.
there you go.
Be safe.
Wash your hands.
Thank you. Yes. Bye.
Okay.
I'd never
that's-
think that you would ever tell the governor of Guam, wash your hands. The times we live in now.
I'm that guy.